Good afternoon, and welcome to our first Summer Cool Sessions for Creatives. My name is Lydia Thompson, and I am Chair of the Department of Art and Art History. Since March of this year, we have been dealing with the impact and ramifications of the coronavirus, which have changed our lives forever. It is important that we stay focused on our educational goals, and during these unprecedented times, through history, art has always added value, intellectual thought, use for problem solving and critical thinking, and it contributes to cultures and the creative economy. It is a reflection of the human condition, and we're witnessing that in real time during the Black Lives Matter protest and movement. The Department of Art and Art History and University Career Center is partnering once again to offer a new series of lectures titled Summer Cool Sessions for Creatives. This series will introduce you to professional creatives in diverse fields in the industry and reboot your energy levels to expand your potential and what is possible as you develop your career goals and build your network. Our guest speaker today is Ms. Susan Yaguda, and she is Manager of Integrative Oncology. Her presentation will focus on the therapeutic art in oncology. She has been in the nursing field for over 30 years and currently is the Manager of Integrative Oncology at the Levine Cancer Institute at the Atrium Health in Charlotte. She manages a team of integrative practitioners who are working with oncology patients, care partners, and staff to provide service and programs such as individual modalities, including oncology massage, healing touch, therapy, and acupuncture. Her group modalities include therapeutic visual arts, music therapy, yoga, Tai Chi, and meditation. Susan, thank you so much for agreeing to join us this summer and share how the creative arts are utilized in healing and comfort patients. Thank you.
Thank you. So thank you for having me today. I'm going to go ahead and get started. I'm going to share my PowerPoint. So you should be able to see it. Just to get started, I don't have anything to disclose. No artists were starved in support of this presentation. And these are some of the things that I'm hoping to discuss with you today, and hope that it opens up some opportunities for you to think about using art in different ways and how art and science and healthcare can intersect. So we're going to look at how art is used to support health across the globe, identify the influence of some hospital art to gain some familiarity with some of the literature, supporting the connections between health and art, to recognize the differences between art therapy and therapeutic art, and also identify some areas specifically where art therapy and therapeutic art can be of assistance and support. And then I'll share with you some of the work that we're doing at Levine Cancer Institute as well with my team of therapeutic artists. So to begin with, I'm going to ask you to just bear with me and close your eyes for just a moment. And I'm going to flip to the next slide. And you can go ahead and open now and just think about what comes to mind, or where even physically you may feel yourself being after looking at this painting, a really famous painting, The Scream by Edvard Munch, and kind of what that evokes, just the experience of looking at it, even though for many of you, I'm sure this is a really familiar painting. And then go ahead and bear with me one more time and close your eyes. And now go ahead and open them. And here is another very famous painting, Monet's Water Lilies. And just do a check-in with yourself. of where you may be experiencing this painting and how that might be different from what you experienced before. So keeping that all in mind, I want to share with you just some literature associated with really how just looking at art, so not even being in the process of creating, but looking, how it can impact our brains and even our cortisol levels, which we know are related to stress. So this was an older study, but I just thought it was worth mentioning, done in London with city workers. And so part of the group got the opportunity to go to an art gallery on their lunchtime visit. And what they noticed is there were reductions in cortisol noted in the city workers who took the lunchtime trip to an art museum. And so within a space of 35 minutes, maybe they had above average cortisol levels, they had dropped below the normal range. They did, however, notice that male participants who arrived with higher levels of cortisol ended up their visits also with higher levels. So this was specific findings associated with, again, just looking at art. This scientist, Dr. Voltarnian from University of Toronto, looked at MRIs of how people were processing art. And again, just visually taking it in. And what he found was that there was engagement in the areas of the brain responsible for processing emotion and pleasure upon viewing art. And the interesting thing was that there wasn't a positive or negative art, meaning that both were pleasurable, much like I would think of reading like a murder mystery book, which might be a little bit more stress invoking, but it's still a pleasurable experience. The act of reading is still enjoyable. And then this was another experiment with this very famous Michelangelo painting. And so what this scientist did is he used this transcranial magnetic monitoring. And what he could do is he asked viewers to focus on that area of the painting that I have circled in red, where the wrist is flexed up, trying to deflect potential injury. And what they found was that the area in the brain actually stimulated muscle contraction just by viewing that painting. So I share this with you, again, just to give you examples of how the simple act of looking at art has a physical impact on us. So how does this lead to how the arts are fitting into healthcare? And this picture kind of illustrates some of what my team is up against sometimes. So we work in an institution that's very driven by science, very driven by research, and a lot of clinical trials going on. And so how integrative medicine and therapeutic arts, healing arts can weave ourselves into that setting is sometimes a challenge, but I like sharing some of the data and the research that has come about that exhibits how there is definitely that connection. So across the globe, the United Kingdom has done some really good work of using their National Alliance for Arts, Healing, and Wellbeing to help promote creativity in arts and healthcare. And the 5 areas that they're focused on is the healthcare environment, participatory art programs, medical training, art therapy, and then arts on prescription. And so what they found after a bit is that, for example, the arts and health and care environments, that mental health recovery in Wales, for example, is estimated to have saved their National Healthcare Service £300,000 over a year. And that was just changing kind of the visual art in the environment. They also found arts on prescription that there was a 37% drop in consults with general practitioners and a 27% reduction in hospital admissions for people that participated in an arts program, and they estimated a cost savings of 216 pounds per person. So again, a significant cost saving as well. And then in also a participatory art program, it led to changes in healthy lifestyle behavior. So people that participated in the arts program, after engaging in it, 79% of people in the communities, and these were high need, high risk communities in London, that they reported eating more healthfully. 77% reported that they engaged in more physical activity, and 82% reported that they experienced just improved overall well-being. So significant cost savings just for integrating arts programs into not just healthcare, but in the community. In Canada, physicians can actually prescribe art to their patients. So in Montreal, for example, the Montreal Museum of Fine Arts allows free admission with a prescription. Doctors can sign up for the program, write the prescription at no cost for their patient. And it's self-promoting, of course, for the museum, but the outcomes have been really positive on health. The museum itself has a medical consultation rooms. They provide services for people with mental health issues, for eating disorders, for autism, epilepsy, and Alzheimer's. And then this is just finally an example of another healthcare institution in the US and Vermont. They have Art from the Heart, so they use artists and volunteers. They have open studio time. They've developed kits that can be delivered to inpatient rooms for patients. And then the staff also, which I thought was a great incentive, is that the staff could get credit towards their employee wellness program if they participated in any of the arts programs. One of the ways that that art in hospitals and healthcare is used as a business is really by either loaning or creating art specific for an area that could be reflective of soothing backgrounds. They can also create videos. There's businesses that do create videos that can be on screens that have different art displays throughout, maybe with some relaxing music. And then they also can have an art cart for inpatient care. And in this, it's not really a participatory activity, but more patients who are in an inpatient setting, they can select a poster of an art that they may particularly find helpful or comforting, and then it can be displayed in their room, and it can be changed out when they're ready. So this is an example of a volunteer with an art cart, and this is St. Luke's Episcopal Hospital in Houston. They provide opportunities, again, for patients to select art pieces. They made sure that the pieces were more soothing, like non-threatening, and 98% of the patients ranked that the art cart service was very important in their sense of control over their situation. When being hospitalized, oftentimes people do feel like a lot of their sense of control is taken away. And it also allowed for more discussion, or as a springboard for a narrative around the art itself between the patient and a care partner. This is a study that I wanted to share with you. I just find this really fascinating. First of all, this is the kind of grant that I would love somebody to provide for me. So Dr. Judy Rollins, she received a grant to travel the world and look at how art in different healthcare settings was impacting the environment, impacting perhaps the patient experience, and she classified them along this list of categories. So meditative messaging, having art itself be an educational tool, inspirational, interactive, remembrance, nature, community, cultural, and empathetic. And so I want to share some examples of her work here. So this is the Children's Hospital of Philadelphia, and you can see, oftentimes we forget that when we're on an exam table, the thing that we view the most is the ceiling. And so you can see how they put this art exhibit up on the ceiling with light shining behind it. to provide just a distraction for the child. And here's just a close-up of that. So these will look like they were moving because of the way the light shines as well. This is a means of using art for education and messaging. So this was in Uganda along a wall on a busy road. And it was just really wanting to educate people on the symptoms at the time of Ebola, the pandemic at that point in time. And, being able to cross any language or learning barriers or literacy barriers, but being able to make sure people understood what some of the signs and symptoms were to look out for. This is a fascinating sculpture to me as well. This was at a Charing Cross Hospital in London, and the artist this was actually in a stairwell, and he has this person depicted as wall climbing as a means of inspiration to those that see it. So another area that art is used to engage with viewers. And then this is an interactive art exhibit. So this has two locations, one at Johns Hopkins at the Children's Hospital there, and then one at a Children's Hospital waiting area in Paris. And so what the artist did is that the children could actually manipulate and move and have interaction between each other. I'm not sure how they did that with the time frame difference, but everybody seemed to think that it was definitely well worth it. And sometimes when you're in the hospital, time takes on a different perspective anyway. But again, just also a way to cross cultures as well. And, children are the best at moving over and through and beyond any language barriers as well. This is an example of a sculpture in our institution. This is, in one of our infusion suites waiting room. So you can see it's very kind of a soothing, a lot of fluidity to it, and some of the birds and the butterflies and the other nature items. And what they did is they used it also dual purpose for wayfinding. And so if you've ever been in an infusion suite, ours is particularly large. It would be easy to get lost there. But if you knew you were supposed to be in the cardinal pod, it would be easy to find that. And so it links to that original work in the waiting area. Sarah Ness is an art therapist at Levine Children's Hospital. She is part of an organization called Arts for Life. And so she herself provides services for children, for parents and care partners at the Children's Hospital, but she also manages a team of volunteers as well. But this was an example of community art. So very simple, really pieces that are woven together here, symbols of hope and love and what's important to different people that contributed to it. And she had this on display in the atrium of Levine Children's Hospital. And then this is an example of a similar endeavor by one of our artists in residence, Jane Watson. And I just love her definition of fiber, that it's an essential quality or strength for toughness and resolve. And this piece ended up filled with different little examples of fiber work, whether it was applique or weaving or knitting or crochet or needle felting, to really show again a sense of community and collaboration. And then Dr. Rollins also identified an area of cultural art. And so this is in North Carolina in Cherokee. This is the Cherokee Indian Hospital. The tribe had the opportunity to take funds that they procured from the casino and put it back into what the community needed, which was improvements in healthcare. Our Native American population is definitely a population that is at higher risk for many health disparities, high risk for diabetes and heart disease. And so just to see that they really were committed to giving back to the community through this beautiful hospital and some of the really amazing programs that they have going on here is very affirming. And so you can see that this is more of a reflection of Cherokee culture of, you can see kind of the river there with stones and, I love the way it kind of meanders and how the light comes into the windows as well. So again, a way to reflect the importance of their native culture while committing to better health. And then I have to say, I think this is my absolute favorite. So this poor guy is sitting in a waiting room. This is at a university medical center in the Netherlands. And I think just his expression says it all. Like we've all felt that way. We're waiting. We might be a little bit anxious about what's going to be about to happen. We're trying to behave ourselves and not make a ruckus because we've been waiting so long. And yet, come on, we've really been waiting. Can we get on with this? At least that's how I'm interpreting him sitting there. But to me, it's just really a powerful example of how we can feel it and how I can, have maybe as a healthcare provider, a better understanding of what our patients are experiencing when they're waiting as well. So I wanted to talk a little bit then about some of the differences between art therapy or creative art therapy. Those terms are used interchangeably. And then therapeutic art or therapeutic art making. So these are just photos of some examples in our institution of some work that our artists have done with patients and care partners. And so just to be clear, art therapy is a mental health profession. So you have to have specific training in psychology, and you have to have a background in understanding certain things like emotional conflicts, addictions, reality orientation issues, even different mental health disorders. There's a specific track that people have to go through in order to become art therapists. It's a board certification as well. And so art therapists not only have to have their own skill set in whatever medium and modality that they use for visual art, but they also have to have that psychology and human development and counseling background as well. It's also, as I said, referred to as creative art therapy. Therapeutic art making is not based on the process of therapy per se. So we do use goals to address broader effects of art making. And so these individuals could just be artistic people who have a caring way about them and are interested in sharing with other people, but they don't necessarily have the psychology background. And so this kind of gives you a overview of the scope of practice between the two professions. So again, what I like to say is that for the artists in residence, which is therapeutic artists, again, those terms are used interchangeably. They don't provide psychotherapy. They don't do an assessment. And there's no specific intervention that's associated with a particular finding. Whereas for a creative art therapist, they're going to really process things with somebody. They are going to make diagnoses and then do the intervention based upon those. There's a lot of similarities, though, which I think can add to some of the confusion between the roles. So just to be clear, both are using these creative opportunities, the enjoyment of creating, of making something together, and making meaning. So I think that's one of the most important things to say, but just to be clear that there's definitely differences. So art therapy and therapeutic art making are used in healthcare for both, depending on, sometimes it's depending on resources that a healthcare institution may have, or how they have determined best to utilize their resources. I can tell you that right now at Levine Cancer Institute, we do not have an art therapist on our team. We have artists in residence, or therapeutic artists is another way to call them. And I'll describe a little bit later why we are, in that path at this moment. So they can focus on helping people through trauma. They can focus on, for cancer care, oftentimes it's just a diversion and a distraction from the day-to-day rigors of cancer treatment. They can also help with processing transitions. Oftentimes along the trajectory of care for our patients, there are several points of transition, and some of them are really positive. I don't mean to make this only reflect transitions that are, like, for example, from active treatment to perhaps palliative treatment or hospice, but sometimes at the end of active treatment, that's a very significant treatment transition that needs to be recognized, and oftentimes is a point where patients really start to experience some psychosocial difficulties, because even their family is like, well, you're done with treatment, let's go. And actually, they're not ready to just let go. They need to really process what has just happened and who they are now, having gone through all of that. Some of our patients also use art as a legacy work. So, they're well aware that all of our days are numbered on this earth, but they may have more close realization of that than some of us. And they want to create pieces to share with their family, for their family and loved ones to have after they pass, as well as for socialization. So having cancer can be a very lonely experience, even for people who are surrounded by family or friends. Oftentimes they'll reflect feeling by themselves and isolated. And so being able to kind of do something with other cancer survivors is often helpful. This is also a helpful intervention for care partners. So care partners can also feel very lonely. It can be a difficult time for them as well. And then our team also provides art for healthcare providers. So those on the front line, I'm noticing it especially now over these past few months, we're all just exhausted, particularly those that are day-to-day trying to manage the difficulties with providing safe care amidst a pandemic. And so we're starting to pull together some ways of creating some art experiences to not only reflect the pandemic and the Black Lives Matter movement, but also to reflect a sense of community and collaboration amongst our teammates across the system. So to begin with, I wanted to share, Melissa Walker is an art therapist at the VA. She has done some just incredible work. She actually has a TED Talk that you might want to Google and listen to. And she's worked with, they had a program through the National Intrepid Center for Excellence at Walter Reed, looking at soldiers who have come back experiencing PTSD or traumatic brain injury. And she used the mask as a tool for processing and to really help them get through that. So if you can look at some of these masks, you can see that there's a dichotomy between the person as a soldier and the person now thereafter, and how they're dealing with things. She has a lot of this work. Again, if you just Google the mass project for NICO, you'll find it. But they've been doing some remarkable research around this too, looking at not only therapeutic art, but music therapy as well, and then acupuncture with these men and women, and finding actually genetic improvements over time that hopefully will be also reflective of their overall well-being. And so we used the idea of mask making in a couple of different ways with some of our patients. So this woman was a patient of ours. She was a professional French horn player, and music was her life. And as you can see from this photo, she has a significant facial droop. she had a tumor in her salivary gland, which is pretty rare and unusual. And the surgery was such that it caused nerve damage. So she could never play the French horn again. The mask that she has is the mask that she wore for her radiation treatment. So she would have to go for radiation every day. She'd be, on her back on a hard table. And then this mask was made and formed specifically for her face. And you can see the little holes around the edge of it. So the mask was bolted down to the table so that she would not move. And that's how she received her radiation. So she wanted to do something positive out of that mask. And you can see that some of her favorite musical pieces are collaged on there. A look at anxiety and depression and fatigue in women being treated for breast cancer. It was a meta-analysis. And what they found was that art therapy benefits them with regard to those symptoms. But they did see some gaps as far as they needed to. What's more difficult in this type of research is assessment tools. So looking at just some design issues with some of these trials, as well as longer follow-up with them too. But it was a significant sample size of over 750 patients across the world there in that study. And then this other study is specific to patients who are receiving a bone marrow transplant or stem cell transplant. This is a procedure that is really quite rigorous and quite a commitment, not only for the patient, but for the entire family. And so the patient in preparation for the stem cell transplant undergoes some really harsh chemotherapy, and then they receive the transplant, and then they're in the hospital for usually it could be up to 4 or 6 weeks. It's an isolating experience, and so they were looking at the art therapist seeing them while they were there, and the reductions in anxiety were found, improved freedom to express their feelings, and establishing connections with loved ones. And again, having cancer changes people's relationships within their family structure. Even very, very strong marriages or family units, there still has to be a shift in dynamic to address the situation as it's changed and evolved. And so our artists have also had the opportunity, it's on hold at the moment, of course, but to spend time in our bone marrow transplant unit and to work with these patients, as well as our music therapist has. And it's been so meaningful to see some of the work that's come out of that. And then this was looking at creative art therapy, so not just visual art, but dance and music, and how it addressed the psychosocial symptoms and quality of life with cancer. And so what they found was, again, there was an improvement in quality of life, an improvement in anxiety and depression and pain for those who participated in creative art therapies. But again, as I mentioned before, some of the issues are the assessment instruments aren't quite what is absolutely needed. Sometimes it's that fitting a square peg in a round hole, but I think it's a good step in the right direction. In Roswell Park, which is a cancer center up in Buffalo, New York, they had patients post-operatively visit an art gallery that they had set up for 15 minutes a day, and they reported improvements in their pain and anxiety, a reduction actually in the necessity for pain medicine. So that's a huge win when you think about you're not only encouraging ambulation post-operatively, but also to have a reduction in pain and anxiety just leads to shorter hospitalization stays. So I have no doubt that the money that was invested in this small gallery has probably, been returned in several fold from the money saved with hospitalization. And then lastly, I think this is the last study I wanted to share with you. They used the structure of Kaplan's attention restorative theory, looking at how patients are connecting with nature and with art for reductions in fatigue. Fatigue is one of the most troubling symptoms for cancer patients. And so what they found is that individual art making was an opportunity for patients to learn about themselves, to self-manage their pain. It also gave them that sense of control and again, enhance their relationships, because it can be kind of a conversation starter. It can be a way of expressing things that might be too difficult to express verbally, but can be expressed through visual art. Oops, sorry, one other one. So this is looking at how this artist interacted with with interprofessional care teams to really establish some collaboration around their values, their responsibilities, their teamwork, communication. And so what the different care team members found was that they really valued the impact of the artist on their unit. They also saw that the value of the artist working with patients, that the patient was going to be attended to and feeling happier, they're going to heal faster and do better. That was especially helpful with pain, that they found for themselves professionally. It helped them stay more calm. And it reminded them also, which I think is so important in the busyness, particularly of inpatient care, that you're not there just for the patient's physical needs, but you're also there to address their emotional needs. So I had mentioned before that art is a really significant tool to use for transitions. And so this woman, she had really, been treated very well for her breast cancer, essentially cured, but she just didn't feel healed. She didn't feel whole. She didn't feel herself. She really struggled with finding kind of her mojo again, and what this new life as a cancer survivor was going to be like. And so she got engaged in our arts program and just has found it to be remarkably helpful to really identify who she is and what was healing to her. I didn't put in the slide deck an example of some of her work, but she's not a trained artist by any means, but some of the work that she has done of some portraits of her grandchildren, particularly during the shelter at home, have been just so touching and so incredibly beautiful, really. This is another one of our arts classes, and again, using some alcohol ink and pen. And then another way that our patients also use, I had mentioned, was legacy. So this was done by a patient of ours. She has a brain tumor that is essentially inoperable. So she's had several different types of treatments other than surgery. And so this is one of the paintings that she's done. You can't really tell from this photo, but there's a lot of texture to this. There's some collage involved in it as well. And it's the empty chair. And this is the poem that she wrote about it. Her name is Clara. The chair is there to remind people that she was here, and that hopefully after she passes, even we'll continue to find an answer to the disease of cancer itself. I mentioned again how patients can be very lonely. Art is used for an opportunity for patients to gather together and get support from one another and from the facilitator. So oftentimes going to a counselor or a therapist or even a support group is just not something that someone feels comfortable with. They may not, from their culture, their upbringing, have that be normalized at all. And so attending a therapeutic art group is a way for them to kind of get that support. and it can also be kind of a step into maybe getting some more in-depth therapy or counseling too, because they'll hear from other people within the art class, perhaps, who also attend, or see a counselor. These chairs were done a couple of years ago for our annual Healing Arts celebration, which is like a gala event we have just to really show the impact of what we do, not only for our teammates and our patients and care partners, but also to those that philanthropically fund us. And so these were yarn bombed, and I just love them because they're so whimsical with the little flowers and spider. And these are two women and one of our knitting circles, who primarily, the knitting circle is what worked on the yarn bomb chairs. This is a quote from Jerry. She's an ovarian cancer survivor, and what she found was not only just she's an amazing knitter, so she didn't need any instruction for sure, but it was just the meeting with other people and collaborating that she found comforting, knowing that there were others that were in the same boat. But she also found that the knitting was helpful for what's called neuropathy. It's a tingling and numbness that people sometimes get in their hands and their feet that can be a side effect of cancer treatment that can be really impactful to the point of sometimes even having difficulty buttoning a shirt. But also, if you're doing something that requires you to use your hands, it can definitely impact that as well. And so this was something that I would love to study. I'm a knitter myself, so I'd love to see, like, can we make improvements in neuropathy just by having people knit? That would be like a total win for me. I wanted to share some of the other quotes that some of our patients shared with us recently about isolation through COVID-19. So we've been doing just virtual classes, doing some videos, some YouTube videos that our patients can click on and do with things that are readily available in their homes as well. But they really like the Zoom classes, or we use Teams as well to get together. And so this woman was saying how hard it was. She's a toucher and a hugger, and that doing that class where they did the masks was really just so healing for her, to be able to release the frustration and the anger and be with other people as well, to be creative. Manuela is one of our artists in residence, and I have a quote from her actually as well. Wanda's an ovarian cancer survivor as well, and she has attended many of our art classes. She loves learning new techniques and working with different mediums, as well as she's attended our knitting circles as well. She found that it helped again with that neuropathy in her hands, and that not only learning new skills, but just being with other people, she found that her anxiety was relieved, lower heart rate and blood pressure. She made new friends. She also is somebody that gives back. So she is very involved with the Teal movement here in Charlotte for GYN and ovarian cancer support. She has auctioned off several things that she has made in these classes, and just some beautiful things. And she's a survivor of 12 years, which is really remarkable for this particular type of cancer. These are some masks that were done with a teammate wellness retreat that we did. I think these were our breast center teammates, giving them a chance as well to get expressive and to learn a little bit about themselves and each other. And I'm running a bit out of time here, but I did want to just give you a bit of overview of some of the work that's being done for healthcare providers. So there's some work being done with nursing burnout. There's nursing burnout, there's compassion fatigue, but there's also moral injury, which is becoming more and more of a concept that we're identifying, where we really are fatigued from wanting to give and conflicted from wanting to give the type of care and being unable to give the type of care. This has come out even more with the COVID-19 crisis as well. But in this particular study, they found that nurses that were involved with these interventions reported improvements in their burnout and compassion fatigue. This was a quilt that a group of nurses did together. And one thing with this was it was also improved. This was an inpatient team that was having some turnover issues, and that also improved their sense of teamwork and of collaboration, of working together. One thing with doing art together as well is we learn different things about one another through the experience itself. And then they did something with doctors who were in training to look at burnout as well. Those that participated in the art therapy sessions reported significant improvements in emotional exhaustion and their personal sense of achievement, and reported that it was a very positive experience. So I think there's a lot to learn from this. And this physician is really a leader and just has made himself vulnerable in such a way that has been very instructive, I think, to other physicians. He himself suffers from some mental health issues. He's an emergency room doctor, and he has really looked at using art as a tool for him to manage his mental health challenges, as well as the challenges of working in an ER, and really to highlight what is now referred to as moral injury or moral distress, which is the difference between the ideal of what we want to provide and the imperfect realities of what's happening actually with boots on the ground. And these are some collages that the artist did with my department as well. Again, it was just really fun to see what different teammates came up with and the different things that we learned about one another through the experience itself. And we also had some knitting circles. So again, it was fun to learn again what other people were doing and how they were managing and how they responded to a challenge. Some had a very short fuse of frustration, and some were like just really determined to get it down. And then who's continued with it and who has not has been really kind of fun to see. So I would be remiss as a nurse to not bring in Florence Nightingale. And she was so far ahead of her time, but she knew that color and light and form was really imperative to recovery. And so I just am continually amazed at her wisdom and her courage and leadership with the nursing profession itself. And then lastly, this is from one of our artists in residence. Again, her name is Manuela, and I'm just going to summarize this sort of for you, is that she started as a volunteer with our program. She's Italian. Her English is broken. She's very self-conscious about that, maybe not so much now, but she was in the beginning, and she has a shy nature about her. But what she found was that the act of making art together, everybody, including herself, really changed as far as a sense of normalcy, of doing something together that had more normalness to it, of having some laughs and some fun, accepting imperfections. And she weaves that so beautifully in and out of the classes that she teaches and leads, that we learn from imperfections, and imperfections is that's a part of life, and particularly when we're dealing with patients who have changes in body image and are really dealing with changes in maybe role in their families or in their profession even. And so this is a piece of work that she recently did, which I just think is so powerful. That actually just really encompasses a sense that everybody is sort of feeling at this point in the game. And so I like to kind of just make sure I circle back around that art and science and healthcare, they're not having to be separate entities itself, that there is a very fluid exchange between all three of these areas that just enhances all three of them, and certainly collectively is a powerful tool and experience. And so both artists and scientists, we try to see the world in new ways and to communicate that. And we see suddenly things a bit differently, a different perspective, and our truth has changed. I'm going to just leave you with some of these resources. I know in the chat box, some of these I think have popped up. These are just, there's a lot out there, but these are kind of some of the top ones. Sarah Ness, who is the art therapist at Levine Children's Hospital, she has her own, actually an online training program that's quite reasonable if you wanted to. It's not an art, it doesn't make you an art therapist, but it's a great introduction to things. If you wanted to check that out, it's Arts and Health Institute. The American Art Therapy Association, of course, will be helpful as far as direction to take in that area. The University of Florida Center for Arts and Medicine has some wonderful programs, both kind of certification programs, but also a good graduate program as well. And then those are my references. I'm going to lead it on this slide, and I'm sorry to go over. I know we started a few minutes late, but I'm happy to try to address any questions that we can in the few minutes we have remaining.
That would be great. I'm not sure whether I'm live at this point.
I can hear you.
Awesome. That's great. Again, Susan, thank you so much for assembling all of that information. That was really comprehensive, and it may very well have answered some of the questions that our students who have been watching the program might have had. I just wanted to add a little bit of context rather than moderation to this discussion, and then turn it over to AJ and yourself so we could take a look at some of the questions that our students wrote. I have been at UNC Charlotte for 24 years. I've been teaching art for about another 10 years more than that. And I've been a professional artist pretty much for the entirety of my life. And all of that defined me. I was always very comfortable in calling myself an artist educator. But when you are diagnosed with cancer, that can also be a definer as well. It's not a positive definer, but it is a very powerful realization. I have been working with the Levine Center, both in Charlotte and in Concord, since 2016, when I found out that I had stage 4 lymphoma. And I would like to just echo the usefulness of creativity and creative awareness as part of an integrative healing process. Because while the chemistry has definitely helped me, and I'd like to report that I am currently in a hopefully durable remissive state, and I'm very grateful to that. There are so many avenues for wellness beyond what shows on a PET scan that make a person whole. And I found the Levine Center to be very attentive to myself and my wife, who was my caretaker, and from small details like the colors of walls, or somebody offering us art making materials while I was receiving infusions, or great fish aquariums, or you know, there were all kinds of personal touches that were subtle and some quite noticeable too, beautiful works of art and whatnot. And I can tell you from firsthand experience that these touches had more than just a subtle difference on my well-being and my wife's well-being, because being told that you're very sick is a very difficult transition to adjust to. And the medicine only goes so far. So I'm thrilled, Susan, that you are here speaking with our students who are interested in creative careers, but may not have really figured out the audience that they want to reach out to. And I can tell you from firsthand experience that the healthcare industry has clients who are looking for relief in all forms that they can receive. And there are terrific opportunities for an artist, whether you are involved with movement art or music or visual art, to make a big difference in somebody's life. And I guess the question that I'd like to ask would be that if I was a student and I had some time to really give my curriculum some thought, while I was still an undergraduate, what kinds of experiences, in addition to art making, do you think would help a student transition to being part of an integrative healthcare team? What do you think, Susan?
So I think definitely having some background in psychology and behavioral health is, going to be necessary and a good foundation for a student to really explore and see, how that fits with them as well. Some of our folks start in the area, for example, of social work even, and then some of them start in an area of counseling to give them that type of background. The American Art Therapy Association would be able to identify like prerequisites if somebody was specifically wanting to go in that direction for a graduate degree, for example. But our team are not art therapists. They're artists who come from different backgrounds. It's not for everybody. We've had some that maybe weren't the greatest fit, or some that needed some coaching to kind of fill into the role. And then we've had some that have been just completely natural people. And I think that's the biggest part of it is, being comfortable engaging with people of different walks of life. Some people prefer just to work in the children's hospital. I know for me personally, I just do not want to work with sick children. To me, that's too hard emotionally. But I think doing also some of that internal check for somebody is a good thing to do too. Like, how are you, as far as your self-assessment, able to manage emotionally some of those difficult interactions? We have to say goodbye to some people, and those are people that maybe we've really formed wonderful relationships with.
Any questions that students typed in the chat box?
Jamie, this is Suzanne. AJ's having trouble with his technology.
Okay, how about you, Suzanne?
Yes, I will. A couple of students have asked a little bit more about the credentialing of art therapy, wondering about different degrees and the types of licensure that's required for art therapy, especially within North Carolina. There's been quite a lot of dialogue going back and forth. But can you speak a little bit more to that about the education required as well as CAPAP? And one student asked if they got their art therapy degree in another state, would that be reciprocal in North Carolina?
I am not 100% sure if it is a nationally recognized certification, or if is state to state. But that the arttherapy.org, I think, would have those answers there. And again, we haven't engaged an art therapist, so I haven't, or we've engaged an art therapist, but not to have her work as an art therapist. She was working primarily as an artist in residence at that time. So that organization, I think, should have those answers. My understanding is that it's a graduate degree. And again, that there has to be not only the proficiency in art itself, but in different mediums, but also the background in behavioral health and psychology and counseling.
Thank you so much. I think AJ was able to join us again. AJ,
did you want to chime in with another one of the feed questions?
Yes, I'm sorry I was out for a second, and there was that the question about the certification with the case that you answered?
Yes.
Okay. Excellent. Yeah, that was kind of one of the main. A lot of the questions stemmed around that certification with the KCREP, and it sounded like there was you addressed moving in between states already.
Well, I could ask another question, and I'd like to touch upon the area of advocacy, because I've found that putting a new program in place involving the arts or adding to an existing program in the arts can require advocacy, because every dollar is precious, every square foot is needed. And how do you wind up advocating with the administrators at Levine that you work with to demonstrate the worth and need of your integrative creative program?
That's a great question. I have to say, I feel very fortunate to be in that setting where what we do is highly valued. So it hasn't been a hard sell to our leadership, from really Dr. Ragavan, our president, on down. We also very intentionally made ourselves visible throughout the institution. So it could be things as far as roving displays in different clinics or different waiting areas of artwork that our patients or care partners have done. But it's also, we have set up pop-up art tables where people coming and going can just pop in and add to a collaborative piece or do something. And then there's also been, for example, our knitting and crochet circle met for a long time in the atrium of one of our buildings. It was a beautiful lighted area, so it lended itself nicely to it, but it also was exposure for us. And so that oftentimes opened up the opportunity for just, walk by conversations about what they were doing, what resources we had, for both patients and care partners, but also for staff, like when staff sees it. And then lastly, the other thing we did was to engage our teammates. So making sure that different clinics understood, when you experience something yourself, then you're going to be a stronger advocate for it. So when we had opportunities to, if there was like a learning day set aside for a specific clinic, we would have maybe an hour and a half to work with that team and do an art project together. And from there, they just would completely buy into everything that we're doing. Then the last, that wasn't my last thing, but this is the engagement with the community. I mentioned that we're philanthropically supported. And so we have organizations like 24 Foundation, Sherry Strong Foundation, that are strong supporters of us financially, and so we maintain engagement with them. We had Sherry Strong board people come and attend one of our classes and see what we were doing and actually make art themselves alongside our patients. We've gone to board meetings for 24 Foundation and done some interactions with them as well. And I'm always sharing photos and quotes and experiences with them, not only to show my appreciation, but to also maintain our engagement with them so that they'll continue to feel that this is a valuable service to support. And again, it's not a hard sell. They're incredibly passionate about what we do, and that passes on along to those that fundraise for them as well.
I can just maybe to put a button on this as we're a bit over. This stuff matters. And if you are thirsty for a way as a creative person to find not only a personal voice, but a community voice, a voice where your ideas, your expression, and your empathy can resonate and have an impact in greater societies, then you might want to consider ways as an applied artist that you can give back to people who really have significant challenge in their life, because you will find that challenged audiences are among the most receptive for your ideas and your work. When you show your art to other artists, sometimes the end result might be a little blasé, or they might give you a stiffer crit than you would really enjoy on a nice day. But if you are looking to ideate and make and share those tendencies with people who it will really make a difference with and will really appreciate your effort, then I would strongly encourage you to rewatch this video, take some of these resources that Susan so thoughtfully assembled and put them together as a personal to-do list so that you can begin to reach out, find out some things on your own, find out some connections with people, and work with your department advisor so that your time at UNC Charlotte can build towards these outcomes of therapeutic creativity, because it will make a difference. Susan, thank you so much for sharing this, and I'm sure you'll hear from members of our community. AJ, Suzanne, and Lydia, thank you also for joining in on the program. I'll close from there. If anybody else has a closing statement, this might be a good time. Thank you.
Thank you for having me.